Welcome, guys. Today we're going to be talking about heart failure in the first week of life. And heart failure is defined as cardiac output which is inadequate to maintain metabolic needs of the body. And heart failure it can be because of reduced or increased preload. It could be because of impaired contractility of the heart, or it could be because of increased afterload. But today, the most important causes will probably be anatomic abnormalities. The causes of heart failure in days 0 to 7, there's a group of duct-dependent lesions. Then there is patent ductus arteriosus in preterm babies, as well as thyrotoxicosis in neonates. Then we talk also of congenital adrenal hyperplasia. Commonly, congenital heart defects would be expected to present at 6 to 8 weeks of age. This is because the commonest types of congenital heart defects are left to right shunts, and these would present at 6 to 8 weeks because this is when the pressure on the right side drops significantly as compared to the pressure on the left side. So, but in this case, we're going to be talking about those that present at birth, unlike the conventional way that heart failure would be experienced at 6 to 8 weeks, or the heart conditions would present at 6 to 8 weeks. In this case, we're going to look at heart failure which presents in the first week of life. So a ductus arteriosus, if it is there for duct-dependent lesions, a ductus arteriosus is expected to close within the first 12 to 24 hours. This is the functional closure of the ductus arteriosus, and it occurs because of oxygen that's being exposed to the baby. So if it closes after this time, whether 12 hours or 24 hours, it means that all the duct-dependent lesions will then present with signs of decompensation. So that's why these duct-dependent lesions present within the first week of life. Also, the ductus arteriosus will be expected to close at 2 to 3 weeks of life. And we know that this is the permanent closure. This is the permanent anatomic closure of the ductus arteriosus. So it means there is a window period after the closure of the ductus arteriosus, the functional closure, up until the permanent closure. There's a window period where we can actually intervene to try and address or reverse the presentation of patients that have ductus-dependent lesions. The duct-dependent lesions can be due to decreased blood flow to the pulmonary artery, as occurs with pulmonary atresia with or without a VSD, pulmonary atresia with a single ventricle, or a severe Epstein anomaly. With Epstein anomaly, this is when the right atrium is enlarged and encroaching into the right ventricle. So there will be impaired blood flow to the pulmonary artery. And this would need a duct to shunt the blood from the aorta to the pulmonary artery. Also, tetralogy of Fallot with right outflow obstruction. If there is pulmonary atresia with tetralogy of Fallot, you know that there is no blood going to the pulmonary artery. So all the blood has to come through the aorta, then channeled through the ductus arteriosus into the pulmonary artery. Then we talk of critical pulmonary stenosis as well. As long as there is not enough or adequate blood going to the pulmonary artery, it means blood has to come through the aorta and through the ductus arteriosus to the pulmonary circulation. Then with systemic circulation, if there is reduced flow to the aorta, this can occur with critical aortic stenosis or critical coarctation of the aorta. And this critical coarctation of the aorta, this is a pre-ductal coarctation of the aorta. This will be duct dependent. Then we talk of interrupted aortic arc and hypoplastic left heart. This will mean there's low blood going to the left ventricle, and we need the ductus arteriosus to be parted so that blood can become from the pulmonary arteries and go to the systemic circulation. Also, a transposition of great arteries. This is when the pulmonary artery is rising from the from the left ventricle, and the aorta is rising from the right ventricle. So in that case, it means there should be mixing of blood if there is to be any life. So the mixing of blood can occur through a VSD, but if there is no VSD, these patients will become dependent on the persistence of the ductus arteriosus. And so if it closes, it means this patient will present with their heart failure or they will decompensate. So these are the causes of heart failure which can occur in the first week of life. Thank you.